Good afternoon, Stephen. It is now May, which means it's graduation season, which means I should probably make some sort of half effort to make the video today fit the time of year. Truth be told, I really could care less whether my posts here are themed or not. It just so happened that the topic I was already going to discuss this month was in the ballpark of relevancy, so I just went with it. A lot of nursing students right now are graduating from nursing school and will soon be out in the workforce. And for the past year or years, depending on the program, they have been told relentlessly what being an RN is really like. So today, with my admittedly limited but still valid experience, I'm going to be addressing the top 3 misconceptions about the profession that I had as a newly graduated nurse starting my first job. Number 1 is that every new nurse should start out as a floor nurse. Stephen, a floor nurse is any nurse in the hospital that is not working in a critical care unit such as the ICU, the ED, or the OR. This whole thought is mostly championed by floor nurses and the occasional ICU nurse who want to prevent new grads from being placed into high-stress situations and therefore getting discouraged early on. To view the floor as a stepping stone or only as a position from which you can work your way up, and they do use that phrase, work your way up, is very insulting to any nurse that actually wants to be a floor nurse. Every nurse is destined for a different career path, and they should pursue whatever department they want to pursue. Starting in a critical unit fresh out of school is definitely difficult, but is by no means impossible. I started in the ED, for example, and even though in the past 6 months I feel like I've aged 2 years, I don't regret it for a second. So misconception number 2 is the supposed divide that exists between the different departments in the hospital. As you float around to the different departments in the hospital during school and you shadow many nurses, you get the impression, based on their gossipings and their soapbox rants, that the different units in the hospital, especially the big 3, the ED, the ICU, and the floor, simply don't like each other. They butt heads all the time, and these disagreements are all rooted in the fact that each department sees the others as their negative stereotype. Floor nurses are divas who can't be bothered to do any real work. ICU nurses are doctor wannabes who condescend to all the other departments, and ED nurses are seen as adrenaline junkies who only care about stabilizing their patient long enough for them to go upstairs. Now, have I encountered every single one of these stereotypes in the hospital? Yes, absolutely. But the types of nurses you see in the hospital are mostly exceptions to this rule, and these stereotypes are in no way the norm. My interactions with the other departments, granted, are limited to simply calling report or transporting patients upstairs, but a large majority of the time, these exchanges go very smoothly and without any incident at all. The divide does exist, yes, largely because each nurse assumes that every other nurse fits their department's negative stereotype until proven otherwise, but we're also used to this by now that, like anything else, it just kind of disappears into the background of our daily routine. The third misconception, and possibly the most terrifying thing for a nursing student to be told again and again and again, is that you do not learn anything in nursing school. That the tests, the assignments, the care plans that you stress over and allow to consume your life hold no relevancy to the job itself. You hear this, you accept it, and you just press on and try to survive long enough to graduate and pass the NCLEX. And now, I can honestly say, having worked in the real world, that this notion is absolutely false. Nursing school does not teach you everything, but what it does do is provide you such a strong foundation of knowledge and skills that without it, any new grad nurse would be completely lost. You will learn an overwhelming amount of new information, but that's going to be true of your entire career. Nursing is a job where you never stop learning. But to say that this learning does not begin in nursing school, but rather on the job itself, is just simply not true. Oh, Stephen, I hope I did not bore you too much, but frankly, this is probably going to be the first of many nursing videos to come. Feel free to reciprocate by making videos about your own career. In fact, I think that you have a lot more interesting things going on in your life right now that would make very good vlog material than I do, so I hope that you make a video soon. Until then, I will see you later. Bye. One thing that you might notice that I did in this video is tried to keep the video more on topic, where I tried to not discuss about our videos in the video itself, or at least I saved it till the end, like what I'm doing now. One thing I actually consider doing is making a new series of sort on our channel, where I can actually talk about our videos in a video. I would label these videos under a different name so that people would know that this is not like a typical video of our channel, where I would feel free to discuss our content, our editing process, our intro material, all that kind of stuff. That's why I could keep these videos on point, on topic, and then have all that extra behind the scenes stuff in a different video. I don't know. What do you think? Let me know.